Hi, this is Dr. Brandon Erickson. I wanted to talk to you a little bit today about meniscectomy surgery in the knee so that you can know what to expect if you're having surgery for this. Now, as we talked about in the office, the meniscus are these C-shaped pieces of cartilage. You have one on the inside of your knee and one on the outside of your knee. And either through an acute traumatic event or through some wear and tear over time, these meniscus can get tears in them. And sometimes these tears can be very painful, or they can cause mechanical symptoms in the knee, like locking, clicking, catching, and pain with rotational maneuvers. Now, if you failed other treatments like steroid injections, or if it's an acute tear in the meniscus and we have to go in and take part of the meniscus out, this video pertains to you. Now, what we do at the time of surgery is we go in through a couple of poke holes the size of my finger and we take out the portion of the meniscus that's torn. The portion that's torn is not currently functional, so you don't lose any function of this part of the meniscus down the road because it's already rendered non-functional because it's no longer attached and doing its job. Now, the surgery is done through two poke holes the size of my finger. We go in, we use a little shaver and a little biter to get rid of just the part of the meniscus that's torn. We leave the rest of the meniscus intact because we don't want to take out more meniscus than we have to. Now, certainly, if when we go into your knee, the meniscal tear looks a little bigger than we appreciated at the MRI when we had our discussion, then I'll fix that tear in the meniscus because you don't want to take out too much of that. But that's uncommon after we have the MRI and our discussion. The surgery is outpatient. You come and go home the same day. It takes about 20 to 25 minutes to do the procedure. Now, after surgery, you're going to wake up and you'll have some pain in the knee and a big bulky bandage around the knee. The bandage that's in the knee, that stays on for about 2 to 3 days, and then you can take that off. You'll just have those poke holes left, and so you can shower normally with this off. And then after you get out of the shower, just cover those poke holes with some Band-Aids. Now, for the pain afterwards, you're going to go home on a regimen of Tylenol, an anti-inflammatory, and a narcotic pain medicine. I want you to take the Tylenol and the anti-inflammatory scheduled for the first few days, and you only take the narcotic pain medicine if you need it. Most people actually don't need that pain medicine, which is great, so we try to minimize the amount of narcotics that you take. Now, right after surgery from this, as long as we didn't have to do any type of repair to the meniscus, you can put full weight on the knee, and I want you to bend and straighten the knee. You'll notice that right after surgery, your quad muscle is going to start to shut down. So I want you to work on getting that quad to wake up with some quad sets, leg lifts, things like that. Usually I have you start therapy about a week after surgery. You can certainly start a little sooner or a little later, but usually a week is a good amount of time to let your knee calm down and then to really start hitting it hard with range of motion and then some strengthening. I'll see you back in the office in about 2 weeks to get your sutures out, and then we'll really make sure that therapy is going well. Now, some people are in therapy for about a month after this, some people a little less, some people a little longer, but that's kind of a good general idea of how long to be in surgery. As far as crutches go, you don't have to use crutches after surgery, but if you feel like you want to use them because the knee doesn't feel quite stable or the knee's hurting, it's certainly okay to use crutches for the first few days after surgery. That's not a problem at all. The other thing that can help with your pain afterwards is using a big bag of ice or just an ice machine that you purchased over the knee. That'll help get some of the swelling out and also elevating the knee. Like we talked about, the more you move the knee, the more you'll get the swelling out. Usually after this type of surgery, I'll have you start jogging and running at around the 4 to 6 week mark, depending on how your knee is feeling. If your knee is still swelling a little bit, we hold off on this. If the knee is nice and dry, then we can start to progress a little more. And we try to get you back into playing sports by the 6 to 8 week mark, depending on how you're progressing. Now, myself and my physician's assistant are always available for any questions that you might have before or after surgery. But I just wanted to give you this video to give you an idea of what to expect. Hope you have a nice day.